Well, good afternoon. Today, I'm ordering the mandatory closure of all non-essential workplaces in the province of Ontario. This order will be effective Tuesday, March 24th at 11:59 p.m. for 14 days. The next 36 hours will give non-essential businesses the chance to adapt and prepare. Tomorrow, we will release the list of businesses that are permitted to stay open. We're prepared to extend this order if necessary. This was a very, very tough decision, but it is the right decision. This is not the time for half measures. This decision was not made lightly, and the gravity of this order does not escape me. But as I've said from day one, we will and we must take all steps necessary to slow the spread of COVID-19. The health and safety of every Ontarian must come first, and that's why we're taking these important steps. It means food will remain on the shelves. It means Ontarians will still have access to their medications and essential products. It means the power will still stay on and telecommunications will continue to run. But it also means that every Ontarian must do their part. If you can, please stay home. Only leave if necessary. To all the snowbirds and Canadians returning home from abroad, you must self-isolate. I repeat, you must self-isolate. The health of your friends, your children, and your grandparents depend on this. You and every Ontarian must do their part. Some people will ask why, or why now? The answer is clear. We must get ahead of this virus to beat this virus. We must slow the spread and flatten the curve. We've seen global economies grind to a halt. We've seen healthcare systems overwhelmed. And we've seen heartache and loss. And we've seen countries lose this battle. Well, I'll tell you, we in Ontario will not follow in those footsteps. We will not lose this battle. We will get ahead of this for the health and safety of all Ontarians, for the future of our children, for those entering their silver years and ready to enjoy retirement. We must get ahead of this, and we will get ahead of this. I've been inspired by the countless stories I've heard over the last few weeks. Stories of neighbors picking up groceries for the elderly. Stories of young people offering to look after children of frontline workers. Stories of business, small, medium, and large, switching production to make essential products. These are the stories that exemplify the Ontario spirit. A spirit that lends a helping hand, a spirit that picks us up when we have fallen, and a spirit that serves as our guiding light in dark times. That is the true Ontario spirit. And it's because of this spirit, I know we will remain strong, we will remain vigilant. And my message to the people of Ontario, I want to be very clear. We have your back. We will get through this together. And thank you, and God bless.
Okay, we'll go to the telephone lines, take questions. First question.
First question comes from Brian Lilly of Toronto Sun. Please go ahead.
Premier Ford, I hate to keep coming back to this, but and I understand that things change on a rapid basis, but when you and your staff, your advisors, are constantly saying one thing 1 hour, one thing the next, it really does make it look like the government doesn't have a handle on this. Shouldn't this, if this is where you're going to be now, shouldn't you have made these decisions a week ago? Shouldn't you be now perhaps going further if you think it's that bad? You seem to be behind the curve every step of the way.
Well, Brian, I can tell you, we have some of the best medical professionals in the world. I'm following that advice of our medical team, the Chief Medical Officer of Health. Brian, as you see, what happened 3 days ago versus a week ago versus today, this is changing absolutely rapidly, hour by hour, and we have to react as it changes. We've made this decision. We had a long debate and consultation with our medical professionals and our cabinet. We've made this decision, and we're going to move forward with it as of Wednesday.
Will you be offering compensation to businesses that have to shut down that had been planning on trying to stay open that now have to lay off their employees?
Well, we'll be announcing what we're going to be doing on Wednesday. The finance minister will be announcing that on Wednesday. So we'll have further comments ahead.
Next question.
Next question comes from Laura Stone of the Globe and Mail. Please go ahead.
Hi, Premier.
Hi.
Thank you for taking our question.
Thank you.
Can you just clarify exactly what you mean by non-essential businesses? We've sort of heard this from you before. So for all those people watching, what exactly are you forcing to close? And does that include things like construction sites?
Well, it's a good question, Laura. We're making sure that we cross our T's, dot our I's. It's an extensive list that are essential, and it's a large list that is non-essential. We will be announcing that tomorrow. And as for construction sites, I've heard the same stories from construction workers directly. I've talked to labor. We've talked to the construction companies. We've talked to the home builders. And, you know, what I have to say with the construction companies, and it's not all of them, by the way, and sites, because it's very different. One size doesn't fit all across the province. But in large construction sites downtown, the pictures I've seen, and they've showed me, and I've talked to the media about it, to have outhouses overflowing, not having proper sanitary items, get your act together. Get your act together. Take care of your frontline construction workers. To have an outhouse overflowing, the picture I saw, it's unacceptable. And if they don't do it, we will do it. We want to work collaboratively with the construction trade. We have a phenomenal relationship with them. But to put their workers, in some cases, not all, in some cases, in jeopardy by going into an outhouse and seeing it overflowing, not having proper water in the outhouses, hand sanitizer, unacceptable.
Okay, and on another topic, regarding your phone call with Prime Minister Trudeau tonight and the other premiers, what will you be pushing for on that phone call? And do you think that the federal government does need to go a step further and enact the Emergencies Act or create more stringent measures across the country?
Well, we have to make sure each province, and I know every premier feels the same as I do. It's going to be up to the Prime Minister to make that decision, but we have to make sure that we're making decisions as a province, because the situation in Ontario is not the same situation maybe in another province, be it PEI or New Brunswick, Nova Scotia. Every single province is different. So we want to make sure that we still have the authority to make the decisions that we require for the health and the economy in each province.
Next question.
Next question comes from Victoria Gibson of iPolitics. Please go ahead.
Hi, this question is for Minister Phillips.
Your fiscal update is supposed to be released this week. How accurate do you think that prediction can be given how rapidly things are changing? And where do you think Ontario's economy specifically will be vulnerable to the impacts of COVID-19?
So we are seeing vulnerability across the economy, and I think anybody who's seeing what's happening in terms of the decisions companies are making, not just in Ontario, not just in Canada, but internationally can see that. The reason that we rescheduled the budget and that we're going to have the economic statement was to be able to look at the most current information in that regard. And so we'll have an economic assessment that I'll release on Wednesday. But I can tell you it's going to be the most prudent statement that any finance minister in Ontario has ever made. We obviously have to look realistically at what the economy is doing, knowing that, as the Premier has said, it's changing day to day and hour to hour, and reflect that in our plan, and that's so that our plan can be practical, and so that we can make sure that the other part of the plan, which will be our response, our first step in terms of responding to COVID-19, can be done in a reasonable scenario. So it'll reflect best economic advice, but it'll be the most prudent any Ontario finance minister has ever delivered, and I think that's appropriate.
Thanks, Minister. And in follow-up, this morning we saw a Conference Board of Canada report that predicted a national drop in real GDP of 1.1% for 2020 if social distancing goes until August, though I know it's tough to know for sure right now how long measures like that will last. And I'm wondering, how deep of a GDP plunge are you currently preparing for, or could the province handle in a worst-case scenario?
We're making sure that we can handle whatever situation evolves, but our planning is very much based on, as I said, the most prudent of scenarios. Obviously, as you pointed out, we don't know how long the situation will last, but as the Premier has said, we put the health and welfare of Ontarians first, that we need to be addressing that directly. That is what is going to be the key, dealing with it directly, important, and I think decisive actions like today are what is going to put us in a position to have the economy recover most quickly. So, so obviously, we'll talk about the details of that on Wednesday, but we are watching it every day, and it is, of course, changing every day. And as I've always said, we'll be very transparent. We will be out and keep Ontarians up to date, not just on Wednesday, but after that, about the status of our economy, and of course, about the status of our plan to slow the growth of COVID-19.
Next question.
Next question comes from Cynthia Milligan of City TV. Please go ahead.
Hi, Premier. This question is for you.
Thanks, Cynthia.
Premier, what I haven't heard yet is any changes to the number of people that can gather in groups. Right now in Ontario, it's 50, which I have to be honest, I'm really surprised that it's still that high. How can you justify it being that high of a number?
Well, that's the advice, again, Cynthia, that we've received from the Chief Medical Officer of Health. But I do have a message. I have a message if you're going for a walk, if you're just hanging out. He recommended, Dr. Donnelly actually recommended this morning, go out by yourself, go out with one other person, your loved one, your spouse, family member, but keep it limited. Keep it limited, and practice social distancing. I just can't stress this enough. Social distancing, 6 feet, 2 meters away from groups of people when and where possible. And I think I see it on the streets. People are listening, but there's always odd times people will go out and gather in groups. The other thing that's really concerning me, Cynthia, is we were on a call with my Solicitor General beside me here with the chiefs of police of Ontario, all the chiefs. And they were mentioning that, again, people coming back, they told us stories that people coming back, the snowbirds and people abroad, not just snowbirds, they're going right into the stores. They're going into the retail stores to get food. I can't stress it enough. It's unacceptable. If you're coming from the airport do not, I repeat, do not stop at a store. Go directly home and self-isolate for 14 days. I've heard numerous stories of a friend or a family member or a coworker that comes back and says, well, we aren't going to listen, we're just going out. Well, I'm sorry, the rules in Florida is not the rules here in Ontario. Down in the US, it is spreading rapidly right across their country. We have to take strict measures to make sure that people, once they arrive, go directly home. I can't repeat that enough. Go directly home and stay in your house, because you're putting your grandchildren at risk, you're putting yourself at risk, and you're putting thousands and thousands of people at risk. When we talk to our medical team, the numbers were staggering about the people that have ended up getting COVID-19. It's over 90% of people that have traveled abroad and have come home and they didn't self-isolate. They're out there, maybe they didn't know at the time, and I'll be fair to them, but take it right now as you have to self-isolate for 14 days. Bottom line, full stop, no negotiating, no store, no running to the gas station, you're self-isolating, simple as that.
Follow up?
Okay, thank you, Premier.
Thank you,
My next
Cynthia.
question is for Minister Elliott. Hello, Minister. I have a letter that was sent to frontline health workers by Lakeridge Hospital, and they're telling them that they have to extend the use of personal protective devices like masks and face masks. We know that 13 people, healthcare workers in Toronto, have been diagnosed as positive. Is this contributing to the cases amongst healthcare workers, and what are you going to do to protect them? How big of a shortage of protective devices do we have?
We have certainly a very adequate supply of personal protective equipment now. We are also working with the federal government to obtain more and more N95 face masks, surgical masks, protective clothing, and so on. So we want to make sure that our frontline health professionals remain safe and remain healthy. They need not be concerned about using this equipment. We want them to use it. It's important for their protection and for the protection of their patients. How do you explain the letter then? That is something that we are following up on, because we want everyone to know that we have an adequate supply of personal protective equipment, and we are actively working with the federal government to obtain more, as well as with other organizations within Ontario that might not need that equipment right now. A lot of dentists, for example, because they're not practicing. We are working with cosmetic surgeons and other facial surgeons. We are getting the supplies in, so we will certainly let the people at Lakeridge know that. We want everyone to know that we have adequate supplies for all of our frontline professionals.
Next question.
Next question comes from Lucas Meyer of News Talk 1010. Please go ahead.
Thank you very much for taking my question. Premier, I have a question about education, but I just want to clarify one thing that was asked from Laura about construction. So to be fair, at this point, it sounds like construction sites will be allowed to remain open, based on what you just said. Can we just get a quick clarification on that they will be allowed to operate at this point?
Well, Lucas, I really would rather roll this out tomorrow. My message to construction sites, because it's so vast, and I'm going to give you an example. If you're up in a rural area and two folks are building a home, and they don't show any symptoms, and people are waiting to get into their home and they've sold their own home, they have to continue moving forward. But a message to every construction worker in this province: you don't feel safe, you don't feel that you have the proper equipment, or the company's not keeping you safe, leave the site. Leave the site and don't come back. We have to make sure that the hospital construction, I'll give you an example, Vaughan, we need to get that up and going as soon as possible. It's absolutely critical that we get that hospital up and moving ASAP. So, my friend, I still want to roll this out tomorrow. We've been in deep conversations with labor, with construction companies, and the folks, frontline construction people that are calling me directly and telling me these stories. Again, with the construction companies, and vast majority of people are doing this. You know, there are some bad actors. So the bad actors is get your act together. That's what we need to do, and protect your frontline people.
And so on education, the education minister was on our air earlier today saying that we should be ready for the closures to go beyond April 5th. But moving forward, have you already started discussions with Minister Lecce and other ministers about the possibility of the school year, you know, not just being canceled all out, but whether or not students will have to repeat their current grade or automatically move on to the next one? Are those discussions already happening?
Well, the minister is doing a great job. Minister Lecce, he's all over this. We have had discussions, but really we have to see where we're going with this virus. Our number one priority is to protect our children. That's our number one priority. And I'll ask the minister to make sure he reaches out to the media to clarify your answer. But we're taking this again day by day. Do I believe, and does the minister believe, April 6th kids are going back to school? The kids won't be going back to school on April the 6th. We will be making sure that we give a proper time frame. But again, this is changing hour by hour, day by day. And I have all the confidence in the world in Minister Lecce, and he'll make the right decision. And we look forward to him monitoring the situation with education.
Next question.
Thank you.
Thank you.
Next question comes from Rob Ferguson of the Toronto Star. Please go ahead.
Hello, Premier. Just to pick up a bit on where Brian Lilley and Cynthia left off. You were scrambling last week asking for suppliers about masks and gowns and ventilators. And you mentioned earlier that you've seen countries lose the battle with COVID-19. So I'm wondering why it's only in the last week or so that we're seeing a scramble. Why wasn't this happening a month ago? Italy was readily apparent a month ago, and it was coming our way.
Well, I'll tell you, I think our team, and including the health team and the frontline healthcare workers, everyone's doing an incredible job. We're working around the clock. They're working around the clock. And when everyone around the world is grabbing N95 respirators, grabbing ventilators, we were one of the only provinces that has taken the initiative to say, okay, the rest of the world, that's fine. We have the greatest people here in Ontario. We will make sure we start building ventilators ourselves. We'll start making sure that we focus on building mask or protective gear right here in Ontario. You have to appreciate how this is evolving day by day. And in saying that, we have, I believe the last figure, we have 12 million gloves, surgical gloves on order, and I'm not too sure. I can't answer if they're in yet, but we have a central procurement table. I want to thank the businesses that have stepped up to the plate in ramping up. When you have billions of people taking N95 respirators off 3M and they can't keep up, or taking all the ventilators down in the U.S., or the U.S. government ordering DuPont not to send Tyvek up in the last week to anywhere else in the world but the U.S., we have to take the initiative to start doing this ourselves, and we can't rely on the rest of the world when they're in a crisis. And we're doing everything we can. I want to thank the businesses, the thousands of people that have called the line asking, how can I support you? We can do this. That's the Ontario spirit, and we're going to get through it. We will get through it.
Right.
Thank you.
Sorry, quick follow-up.
Yes.
What was the turning point then? Why all of a sudden were you pivoting to reaching out to manufacturers? What kind of advice were you getting from public health at that point, or in your own mind, what were you seeing on TV that made the light bulb go on that this needed to happen right then, and it needed to happen fast?
Well, I can tell you, I did procurement for 30 years, supply chain for a number of years. And there's a point that you see when the supply chain on medical devices coming in from the US, coming in from around the world is drying up just due to the sheer volume. You have to react. We reacted immediately when we saw the supply chain drying up. I had a conversation with the president of GE about making sure that we have ventilators, and our procurement department is reaching out to companies like Medtronic, Philips. I could name them all, and realizing even though we have ventilators and we had them on order, I'd rather be safe than sorry. I'm kind of like the guy that has the belt and the suspenders in a crisis. I'm not going to rely just on a lot of other regions that say, okay, well, we have 500 ventilators, and all of a sudden you see what happens in New York. Literally, in a week or 2 weeks, you just see a spike ramping up. We saw the increase today. If you would have asked me a week ago, when we have 78 cases in one day, I wouldn't have been able to answer that because we didn't see the drastic spike. And so we're taking all measures, and everything's on the table. Everyone's working literally around the clock. When I say around the clock, I'm on the phone with our procurement people at 11 o'clock at night, talking to them. We have a central procurement table. We've called in consultants to help us make sure that we source from the private sector, from hospitals, make sure their labs are up and going, from Ontario Health to make sure that universities' labs are going. So it's all hands on deck. We're leaving no stone unturned, and we're going full steam ahead on making sure we have the supplies. And as the minister said, we're seeing now, because of the work we did in the prior week, in the last few days, supplies coming in. So we're going to make sure we monitor it. I'd rather have more supplies than less supplies.
Next question.
Next question comes from Allison Jones of the Canadian Press. Please go ahead.
Hi, Premier. I just want to follow up on your comment that kids won't be going back to school on April the 6th. I'm just wondering if you can tell us any more about how you're going to go about making those decisions. Is this going to be a week-by-week thing? Are you, as was asked earlier, just going to decide at some point that the entire year is a wash?
Well, Allison, I know the minister will be rolling out more comments over the next day or two. I really would like him to talk about the education system. But the reality is, and I think everyone in this province knows, the reality is April the 6th is not realistic right now. We're in a state of emergency. We're making sure that people are safe. And our priority is make sure our kids are safe. That is the #1 priority.
Okay, thanks.
Thank
and I'm also wondering if your order to close non-essential businesses is going to come with any sort of penalties for people who violate that?
Well, we have hundreds of thousands of businesses, small, medium, and large in the province. We have to police ourselves. Yes, will we have bylaw enforcement? Yes, we will. But, we have scarce resources. Everyone is going around the clock. So when we ask non-essential businesses to close down, we're asking them to close down. If they want to break that, well, there will be consequences. But we don't want to run that way. We're all in this together. We're a team. It's not about government versus business. We're partners now. The business sector, small businesses and medium businesses and large, we're working together like this. So do the responsible thing and close your shop. And a lot of companies haven't even needed this order. They've closed their shop or closed their office. And even the ones that are non-essential, if you can work from home, it doesn't mean closing business. It means your facility. We don't want people in the facility. If you can do stuff off-site at home by yourself, I'd do it. But it's absolutely critical that the people listen to the orders. Again, we can't be knocking on every single business in this province, checking on them. They have a responsibility. And I want to repeat, we have incredible businesses, incredible in Ontario, and vast majority are cooperating.
Next question.
Next question comes from Colin DeMello of TV. Please go ahead.
Hi, Premier. I just wanted to ask about the enforcement measures. When it comes to the mandatory order to shut down businesses, will the OPP be brought in to enforce any of those closures?
Well, that's a great question for my Solicitor General here.
Thank you. So certainly moving forward as we get into which businesses are going to close, there will be a role, unfortunately, for some individuals who choose to ignore those orders. And our policing partners are actively engaged and will be part of that enforcement if and when it is necessary. Thank you.
And so to both the Premier and the Solicitor General, I mean, you're expressing a lot of frustration that people are not staying at home. Frontline police officers are telling us the same thing, that they're seeing people out and about, despite the fact that you, over the course of multiple days, have told people to stay at home. People don't seem to be getting the message. So why not issue a mandatory stay-home order that police would be able to enforce as we continue to battle this pandemic?
You know, Colin, the people are getting the message. A small group are ignoring the message. Again, we're all in this together. Ontario, the residents of Ontario play a big part in making sure we get through this. The government's always going to be there for the people, both municipally, federally, and provincially. But we have to be responsible. We have to be responsible. Please stay at home when you can. We can't, you know, there's 14.5 million people in Ontario. Our resources are spread thin. We want to focus on making sure we flatten this curve and contain the spread. So I think the resources should be put on healthcare, and the police are doing everything they can. The police are human, like we are. They have some police agencies. They have people self-isolating themselves. Not just private sector, but they're self-isolating some folks. So we all have to work together. I don't know how much clearer everyone can be. And you know, Colin, I got to thank the media. You guys are absolute champs. You're making sure you're getting the message out. Stay at home, no matter if it's in the papers or on the radio or on television. You guys are doing an incredible job getting the message out. But there's always going to be that small little group, Colin, that are going to break the rules. We need to hold them accountable. I don't care if it's public shaming or whatever. Follow the rules. And we see businesses open. I won't hesitate to call them out by name. Just follow the rules. We're protecting each other. Again, I can't monitor 14.5 million people. But in saying that, the vast majority of the people are cooperating. So I thank you. I thank the businesses. I thank the people of Ontario for their cooperation. And I thank the media for continuously repeating the message.
Okay, this will be the last question.
Yeah.
Next question comes from Mike Crawley of CBC News. Please go ahead.
Hi, Premier. I'm hearing concerns from a lot of medical experts that Ontario is failing to detect a bunch of positive COVID-19 cases out there because of the limitations on the testing. How can the people of Ontario trust that the numbers that are being reported actually reflect the true reality of how quickly this virus is spreading?
Well, what I should do is hand this over to my Minister of Health. She'll be able to answer that.
Well, thank you very much for the question, Mike. And in fact, we have been doing testing in other locations with people who've not reported symptoms, with people in long-term care homes, for example, and other locations, congregate care. And we've done that testing of those people, and they've come back negative. We've had a few reports recently of positives, but the vast majority, 99.9%, are coming back negative. So we do appreciate that it is important to do that testing to understand really what's happening in the community. But so far, those tests have come back for the vast majority negative.
If I could follow up, and maybe the Premier could take this. You had said last week that you're aiming to have 5,000 tests a day being processed. Right now, there's only 2,000, roughly speaking, each day being processed. Why is it taking so long to ramp this up? Like, why not reach out to the private labs or university labs if
Mike,
Public Health
good
Ontario
point.
and the hospitals can't handle the volume?
So we're doing exactly that. We're reaching out to the university labs. I know U of T is working on it. We're reached out to the private sector, be it the folks, I'll say one name, Apotex. I was speaking to the president CEO over there, making sure they're engaged, their labs, their people. We're leaving no stone unturned. And the biggest issue is the product called reagent. We have pharma companies working on it here, but reagent is in rare supply right now. I understand, Mike. Everyone in this province, including myself and everyone here, we want one thing. We want certainty in life. We want certainty that we know that we don't have COVID-19. Our goal is to ramp up. It's not from holding back anything. We need the reagent, and we're working on that to get more supplies and also the kits. We have more kits coming in. We have 56 assessment centers. We're going to expand on that. We're looking in some assessment centers. There's drive-throughs, but until we can increase the volume, I understand. We're going to do everything in our powers to get more reagent, the fluid that you put the swab in, and give people certainty. That's what's going to continue curbing the spread of this and giving people certainty going into work. If they know they've been tested and it comes back negative, they're going to feel a lot better going to work. We will spare no expense, nothing, to make sure we get a hold of this product and start expanding it. I'm literally sitting at the table, the procurement table, and sitting in on some of the health meetings as well. We're going to get through this, and we will be able to, once we get more reagent, ample supply. We do have it, but ample supplies. We're going full steam ahead. But I thank you, Mike, for that question. Thank you, folks. Appreciate it.
Thank you.
Thank you.